Hi, everyone. It's All right. Well, good morning. I am Sarah Altheger. I'm the managing editor. Feel free to type those into the Q&A icon on your Zoom screen. So you'll want to click on the Q&A icon at the bottom of your window, and another window will pop up and you can type in your question. Again, we'll be reserving the question and answer portion for the end of the webinar. A recording of today's webinar will be made available after it's over, and we'll email that to you. Feel free to chime in on Twitter or Instagram or Facebook using the hashtag #SoyWebinar as we go along. And then the last thing we want to do before we begin is to ask the second question: to what degree are you aware that a concern exists about the connection between soy and male and female fertility? Third question: do you view soy and soy foods as a healthy nutritional choice? And the fourth question: how likely are you to recommend soy foods to your patients, clients, or others you advise? Go ahead and key in your answers there on the polling window. Give about 15 more seconds. Okay, we're gonna end that poll and then show those results really fast. So it looks like about 62% of those on the webinar have not received questions about soy and the relationship between soy and fertility. About 30% have. Attendees are somewhat aware that there is a concern that exists between the connection between soy and male and female fertility. 93% view soy as a healthy and nutritional choice. A nutrition consulting company. He's also an adjunct professor at Loma Linda University. His research focuses on the health effects of soy foods and soybean components. He's chairman of the Soy Connection editorial board and executive director of the Soy Nutrition Institute. Mark, I'm going to stop sharing my screen and turn it over to you.
Well, thank you for that introduction, Sarah. And it is a pleasure to have this opportunity today to share with you information about the health effects of soy foods, and specifically, and the population of China is approximately 1.4 billion. Perhaps some could argue that China would have 2 billion people, but I don't think that argument is very credible. Nevertheless, despite their long history of consumption and their very large population, in 1994, an article in a newsletter that was published by the Perinatal Nutrition Practice Group, which no longer is in existence, but one of the practice groups of what was known then as the American Dietetic Association, recommended a type of clover that were very high in isoflavones. And then about 30 years later, one of the true pioneering researchers in the soy and isoflavone field concluded that a diet rich in estrogens may be one of the major factors in the decline in fertility in cheetahs kept in North American zoos. Furthermore, he went on to note that the analysis of the feline diet revealed large amounts of two plant estrogens, daidzein and genistein. These are the primary isoflavones in really the only way to incorporate large amounts of isoflavones via dietary means. And you can see this point illustrated on the slide. Average intake among older Japanese individuals is about 25 to 50 milligrams per day, really tends to be at the higher end of that range. In contrast, per capita isoflavone intake in the US and in Europe is fewer than 3 milligrams per day. There are about 25 milligrams of isoflavones in one serving of a traditional soy food. And you can come up with a pretty decent estimate of isoflavone content in traditional soy foods if you multiply the gram female reproductive hormone. Because of the similar chemical structure, isoflavones are able to bind to estrogen receptors and in fact can exert estrogen-like effects under certain experimental conditions, and for that reason they are commonly classified as phytoestrogens or plant estrogens. However, despite their classification as phytoestrogens, they are very different from the hormone estrogen, and sometimes they can have effects opposite to those of estrogen. And it's really easy to conceptually understand how two molecules similar in chemical structure can have very different and even opposite effects when one considers increased blood cholesterol levels. In contrast, a couple of grams of phytosterols consumed every day can lower blood cholesterol 10 to 12%. And these two chemicals are much closer in structure than our isoflavones and estrogen, and yet they have very opposite effects. In some cases, isoflavones do not elaborate a little bit about the comparison with isoflavones and estrogen. They are similar in structure, but they certainly differ at the clinical level, and they also differ at the molecular level in terms of how isoflavones versus estrogen binds to estrogen receptors. And I'll be happy to address a question in more detail about that at the end of the presentation. I do want to get back to the sheep and the cheetah. In the case of the sheep, the animals were consuming gram quantities of isoflavones, and recall that average intake from the body. The felines are unable to do that, so their blood levels are very high compared to humans. So why did this article in the Perinatal Nutrition Practice Group newsletter recommend avoiding excessive intake of soy to maximize fertility? Well, it's because of a 1994 publication by Cassidy and colleagues that found dietary modifications can lead to significant changes in the regulation of the menstrual cycle. Now, more specifically, they found the soy protein given daily for 1 month significantly increased follicular phase length, the luteal phase, and you see very high progesterone levels during that phase. And I'm going to come back to this slide in just a moment. So here we have the results of that 1994 study. You can see when the women consumed the control diet, the follicular phase length was 15 days. When they consumed soy, about 45 milligrams of isoflavones, so that's well within the normal dietary range for a Japanese. When they consumed soy, the follicular phase length was 17.5 days, 2.5 days longer, and the difference was statistically significant. And this was a very well done study, only 6 women. It's because breast cell proliferation is highest during the luteal phase and is correlated with progesterone levels. So when cells replicate more quickly, they have less time to repair any DNA damage that may exist, and therefore they're more likely to be transformed into a cancer cell. And as I noted before, during the luteal phase, you have very high progesterone levels, and during this 2-week period, breast cell proliferation is much, much higher than it is during the follicular phase. So if you have a longer follicular phase, it means cancer. And here again, with these follow-up findings published 1 year later, the researchers were focusing on the potential anti-cancer effects of soy, not discussing fertility. So let's look at this follow-up research. So we have 4 different diets. Again, the women were housed in a metabolic ward. The first diet, textured vegetable protein, 60 grams per day. These are the results from the study from 1994. They also published them in their follow-up study. Then you have a miso diet, which led to an increase in follicular phase length, 19 versus 6, half the dose of TVP that they did in the first diet, and half the level of isoflavones. But what's interesting is that you see in response to miso an increase in follicular phase length, 16 to 19, whereas there was no change in response to textured vegetable protein, even though the isoflavone content of those diets were the same. And this suggests that unconjugated isoflavones may be more biologically active than conjugated isoflavones. So let me explain that point for a minute. In soybeans, and unfermented split off. And so you're consuming foods that contain isoflavones without the glucose in aglycone form. And there's some evidence to suggest that when isoflavones are present without the sugar, they're absorbed much more quickly, and so they may act somewhat differently than isoflavones that have the glucose molecule attached. Very speculative, but that is one difference between fermented and unfermented foods. Let's fast forward more than a decade to look at a meta-analysis that evaluated the effects, but you do see that follicle-stimulating hormone and luteinizing hormone levels were decreased about 20, 25% or so. That was barely statistically significant, but you do see this decrease. Now, menstrual cycle length was only increased about 1 day. So we're not seeing, based on 10 studies, the large increases in menstrual cycle length that we saw in those first 2 studies by Cassidy and colleagues. And to be honest, I'm not even convinced that soy affects luteinizing hormone levels and follicle stimulating hormone levels. And the reason I say that is because in the case of these 2 hormones, there were only, in this case, there were 98 women involved in this study, more than the combined amount of women involved in the 7 studies in the meta-analysis, and there was no effect whatsoever on follicle stimulating hormone levels. And bear in mind that the women in this study consumed 235 milligrams of isoflavones per day. So 5 or 6 times more isoflavones than typically consumed in Japan, and yet you still see no effect on follicle stimulating male fertility. I want to discuss one very intriguing study. It's just one study, not possible to reach any definitive conclusion, but the findings are actually quite exciting. This was a cross-sectional study, epidemiologic study, that concluded soy food intake may protect against the adverse reproductive effects of BPA, bisphenol A. Now, bisphenol A is classified as an endocrine disruptor. It's a chemical produced in large quantities for use primarily in the production of plastics and urinary BPA concentrations. So as you go from quartile 1 to quartile 4, that indicates women were exposed to higher amounts of this endocrine disruptor. And then you'll see now that as exposure increased, the likelihood of giving a live birth, having a live birth, decreased quite dramatically, and that trend was very statistically significant. So BPA exposure was reduced from this one preliminary study that soy was negating the harmful effects of BPA on reproduction. Now let's take a look at male fertility. And there's no question that this topic rose to the forefront of consumer consciousness, and I think even awareness within the health professional community as a result of a 2009 article in Men's Health that focused on soy. And it basically concluded that this is the most dangerous, that found soy supplements reduce serum testosterone levels. Now, the decrease was only 6%. And importantly, they actually reached statistical significance when they compared the final values in the soy group to the baseline values. They did not compare soy to the control group, even though there was a control group. They didn't report the data for the control group, which to my mind is inappropriate statistically. And again, there was only a 6% decrease, and it was in response to 120 milligrams of isoflavones per day. That's American male consumes about 90 grams of protein per day. So this was a huge amount of soy protein, much more than anyone should consume. But what really, I think, made the article and what attracted so many people to this topic was the discussion of a case report that was published in 2008, in which a 60-year-old man developed gynecomastia, which is breast development in men, a small amount of breast development, allegedly in response to his consumption of soy milk. Has about 110 calories perhaps. It's very clear that this person was probably getting 2/3 of their total caloric intake from soy, which suggests that the diet not only was unbalanced, but perhaps even nutrient deficient. So I don't think you can learn very much from this type of case report other than that consuming excessive amounts of any single food can be problematic. In 2010, a meta-analysis addressed the issue of, and this is a very busy chart. It provides the data from that meta-analysis. So I'm just going to focus your attention on the yellow rows. You can see for total testosterone, 32 treatment groups, so it's a large data set. And then you look at the p-value, 0.49. You know, traditionally 0.05 is used as the value for determining statistical significance. So this was not even close to statistically significant. If you look at free testosterone, the biologically active form, 43 groups looking at total testosterone, p-value 0.86, not close to statistically significant. Unbound or biologically active testosterone, 17 groups, p-value 0.07. So the clinical studies, these are all clinical studies, are very clear. Soy does not lower testosterone levels, even in response to very high amounts of isoflavones in soy. Now in 2010, I published a narrative review that looked at the effect in men. Estrogen is actually considered to be a male reproductive hormone as well as a female. And interestingly, older men actually make more estrogen than older women do because men convert the testosterone they make into estrogen, whereas in older women, ovaries have largely stopped producing estrogen. But again, this is a narrative review. I did not apply statistics to the 9 studies that evaluated estrogen levels. Well, in the updated analysis, now I mentioned the importance of that case report in terms of drawing attention to the possible feminizing effects of soy. And I was only able to identify one study, one clinical study, randomized clinical trial that actually looked at whether isoflavones have an effect on breast tissue in men. It's an important study because the men consumed 100 milligrams of isoflavones per day. So they were at the very high end of the dietary range that found higher intake of soy foods and soy isoflavones is associated with lower sperm concentration. Now, I think this study drew a lot of attention in part because it was published by Harvard researchers, and it was the first of its kind to be published. It's a cross-sectional study. It's not a clinical study. So this involved 99 men who were partners, part of a couples who attended an infertility clinic. And you can see the investigators divided the men into 4 groups. Here we see in the highest intake group, men only consumed about 1/2 serving of soy per day. Then you see the sperm concentration was 72 million per milliliter in the high soy consumers versus 106 in the men who did not consume soy. Now that difference was statistically significant, but bear in mind anything above 20 million is considered to be within the normal. And when you actually looked at total sperm concentration, there was hardly any difference among the groups. And in fact, there were no statistically significant difference between the no soy consumers and the high soy consumers. So again, this study does not bother me in the least, especially because when you're going to address a question like this, you really need to base your conclusions on the clinical data. And 3 clinical studies, intervention studies, study went from 2 months to about 3 months. And then the dose of isoflavones, 40 milligrams in the study by Mitchell, about 1.5 servings of soy per day. Next study was about 2.5 servings per day. And then the third study used supplements, huge amounts of isoflavones, up to 480 milligrams per day. No effects on ejaculate volume, sperm concentration, sperm count, sperm motility, or sperm morphology. And interestingly, those Harvard researchers that published that paper in 2008 showing lower, because I think this case report is often not cited in the literature. These individuals, Italian research, concluded that isoflavones may actually be a treatment for oligospermia, which is low sperm count. In this case, they were dealing with an individual, a male of a couple who was unable to conceive a child. They were attending a fertility clinic. Turned out the male had low sperm concentration. He consumed 80 milligrams of isoflavones daily. That's about 3 servings. As I mentioned, this is the article that really started the concern about male feminization and male infertility. In 2015, they noted in an article on plant-based milks that soy contains phytoestrogens, plant-based hormones that may in excess lead to dips in testosterone. Up to 4 servings a day, however, shouldn't hurt. Well, it would have been nice if they had included that statement in their original article, because no one should be consuming more than 4 servings.
Evidence surrounding soy and male and female fertility. So now we're going to shift over to a few questions. And again, if you'd like to submit a question, if you click on the Q&A icon at the bottom of your Zoom window, you'll be able to type in some questions there. So Mark, we do have a couple questions coming in. The first one is, are there any in utero effects of maternal soy consumption?
Levels. And it's very unlikely, in my opinion, that the isoflavones, because they are so much less potent than estrogen, are likely to have an effect on the fetus when it's often said that the fetus is actually swimming in a sea of estrogen.
Okay, thanks, Mark. Second question, as a breast cancer survivor who always thought I could not consume soy, but am I correct now that it is okay to consume soy?
Deficient. It wasn't until about a decade later that the population studies actually found that consuming soy after diagnosis of breast cancer is associated with a decrease in risk of recurrence and an increase in breast cancer survival. And these are studies from China and from the US. So they're showing that the observational data show that soy is beneficial for breast cancer patients. The clinical stuff within just a matter of weeks. No effects of isoflavones, no effects of isoflavones on breast tissue density. So the data would suggest that soy is safe, and that's the position of the American Cancer Society, American Institute for Cancer Research, Canadian Cancer Society, and the World Cancer Research Fund International.
Okay, thank you, Mark. How many milligrams of soy per day were consumed in the study that found isoflavone intake could be used as a treatment for oligospermia?
No, the second part first, no, I would not. There's not enough data to suggest that soy improves the chances of conceiving. There's a lot of data to suggest it doesn't decrease the chances of conceiving, but not enough to make that recommendation. So the recommendation for women who are attempting to become pregnant would be the same recommendation that I would make for women not in that position, and as well as men, is a very reasonable goal. And bear in mind that if you're getting the isoflavone, certainly from soy foods, you're getting high quality protein, a food that's generally going to be low in saturated fat, high in PUFA, variety in vitamins and minerals, especially potassium, the B vitamins, and you may end up displacing less healthy foods from the diet. So I think 2 servings overall is a decent recommendation.
And is there can you have too much soy? Can you
more than 4 servings per day? You're putting too much emphasis on a single food. If you just assume, for example, that a serving of soy foods is going to provide maybe 8 grams of protein, 4 times 8 is 32, you're going to be getting, depending if you're a man or a woman, perhaps anywhere from 50 to 60% of, or maybe 25 to 50% of your diet, of your total protein intake in the form of soy. And I don't think you want to go
male and female fertility. And if there are questions that come in and we didn't have time to get to them, we'll connect Dr. Messina with you via email so we can address those questions. If what you heard today was helpful, we would encourage you to connect with us on our social media platforms, Twitter, Instagram, and Facebook, or visit thesoyconnection.com for more information where we share resources, recipes, tips about soy foods, research-based information, and more. We will be hosting another Soy Connection webinar and content. With that, we will conclude today's webinar. Thank you again for joining us. Take care and be well and have a wonderful day.